for joining us for the 47th Annual AAKP National Patient Meeting. I am Leigh-Ann Williams, and I am an AAKP Ambassador for the state of Louisiana. I have been on dialysis since April 2016, 1 month before I was set to graduate from college. While I initially started as an in-center hemodialysis patient, I recently celebrated my 5th year on home hemodialysis. Being part of AAKP allows me to live out the mission of AAKP that also aligns with my personal mission as a patient advocate, and that is to educate and raise awareness for kidney disease and patient choice, to advocate locally and nationally for patients, and to inspire others with my testimony and tenacity. My mantra is "These kidneys won't hold me back," a testament to the fight and determination that this community of kidney warriors possesses. I'm pleased to moderate this session on Be Prepared, what kidney patients should know before going into the hospital, as it is such an important topic. As kidney patients, we may be managing a number of related health conditions, taking medications, or have a vascular access that providers caring for us must be mindful of. As a patient, you know your health and body best. It's important to be your own best advocate, especially at times when you may be with healthcare providers that are different than your normal team. Today we have with us friend and ally of AAKP's, Dr. Rohan Paul. Dr. Paul is a transplant nephrologist with Washington University in St. Louis and the George Washington Transplant Institute in Washington, D.C. He is a clinician, an NKF-funded translational researcher, and a patient advocate. Dr. Paul is also a member of the American Society of Transplantation's Public Policy Work Group and is committed to promoting kidney patient choice and transplant access in partnership with AAKP, government, and other stakeholders. Dr. Paul, I turn it over to you.
Thank you, Ms. Williams, for the very kind introduction. I also want to thank Mr. Paul Conway, Ms. Diana Kleins, and the AAKP for the very gracious invitation to present this particular session, which is primarily targeted towards patients, caregivers, families, and there's also some tidbits towards the end that I included for experts that are involved in policy development, design, and implementation. So I have no relevant disclosures for this presentation. So for way of background, I included this little cartoon to help patients and families reflect on the patient journey. I just want you for a moment to think about your daily routine as a kidney patient, like taking medications, adhering to a certain diet, adhering to a certain fluid restriction. You follow your medical routine, but continue to work, you continue to go to school if that applies to you, you go to your dialysis unit where you also have a routine. And whenever you run into issues, you have the option to talk to your doctor either via email, phone, or going in person to the nephrologist's office or your PCP or your general, your specialist if that applies to you. But then sometimes that system can break down. So when this process breaks down, such as if you're having an acute medical emergency, you need to seek care immediately, which is going to be outside of the realm of your regular doctor's office. And patients describe going to the emergency room as very stressful, scary, frustrating, and above all, they feel very vulnerable because they're in a dire situation where they're having a problem, sometimes at an odd hour in the night, and without access to the regular doctors where they know them well. And all of a sudden, they're in the hands of medical staff that don't know their medical history particularly well. And it's also dangerous for these reasons. So the goal of this talk is to help connect the ER with your regular continuum of care and help facilitate clear communication between the emergency room staff, your doctor's office, your dialysis unit, and other specialists involved in your care, including the hospital if you end up being admitted, to avert the dangers and adverse outcomes that we typically associate with an emergency room visit. So what do we know about ER visits by kidney patients? The fact is that it's very common, and there's data that illustrates how frequent ESRD patients need to go to the emergency room. And we also know that ESRD patients that go to the ER are more likely to be African Americans, people of Hispanic background, they're also more likely to be sick and to get admitted either to the hospital or to the intensive care unit. And reasons for hospitalization or ER visitation include having issues with their dialysis catheters or access, infection, having issues with congestive heart failure, which can cause shortness of breath or chest pain, or electrolyte issues. And the sad reality is that many patients actually start hemodialysis in the emergency room, and many of these other issues that are not dialysis related can also be prevented upstream in the community, which would avert needing to have to go to the emergency room in the first place. So how can we address this problem? Well, the first and obvious thing is to avoid needing to go to the ER in the first place. This means developing a careful care plan with your primary care physician, your nephrologist, or your dialysis provider, or your other specialist to make sure that your health issues are controlled and managed so you're less likely to need an emergent medical attention. But then, of course, despite everyone's best intentions, emergencies will happen. And with those situations in mind, those potential situations in mind, it's important to have an emergency action plan. And that means having an emergency folder and an emergency kit, which we'll be talking about, and also thinking about things that you can do before heading to the emergency room that'll facilitate easy and smooth care once you're in the ER. It's also good to know what to expect when you get to the emergency room, and also to keep in mind some do's and don'ts whilst under the care of the ER staff, again, to make sure that your care is smooth and gets you the best clinical outcome. So how do we avoid having to go to the emergency room? First, please recognize that kidney conditions are common, and you certainly are not alone if you've been diagnosed with a kidney condition. Per the CDC, more than 1 in 7 people have chronic kidney disease. But knowing your condition means having power over your condition. So it's important to ask questions. Ask your nephrologist why you're on a particular medicine. Ask your kidney doctor why they think that you have a kidney condition. Ask your dialysis nurse and other dialysis staff as to why you need to adhere to a fluid restriction if that applies to you. Basically, be the best person and most knowledgeable person about your medical care as possible. Even talk to fellow patients, people in and outside of AAKP who can share their journeys through the kidney disease process, whether it means being on dialysis, PD, or transplant, so that you can get to learn more about what it means to be a kidney patient and to have control over your condition. And of course, unless you have a specific reason not to, do seek vaccination against COVID-19. The bottom line is that the more informed and in control you are of your own condition, the less likely you are to be that patient that runs out of medicines on a Sunday morning when everything is closed. The less likely you are to be that patient who misses 3 sessions of dialysis due to a lapse in communication with the dialysis unit, and therefore the less likely you are to be that patient that needs to go to the emergency room. As I said, despite everyone's best intentions, emergencies will happen, and it's always good to have a plan in place. Things that you can do before going to the emergency room to mitigate the anxiety and chaos of being in a hospital where there's staff that don't know you is to do certain things. First, pack your emergency folder and your emergency kit, which we'll talk about in the next slide. Also remember to pack your pill bottles, and that means the actual bottles, not just the pill box, because the pill box won't contain the names and doses of your medications. If you wear glasses or hearing aids, please remember to take that with you. Also pack any portable medical equipment such as a CPAP machine, because it may be needed should you be admitted to the hospital. And if you're unable to do this yourself, remember to ask a caregiver or family member to do this for you. And if you're on your own, just politely ask the EMS crew to make sure this equipment comes with you when you go to the hospital. Also take a moment to pick up the phone and call certain people before you head to the ER. Notify your doctor or your dialysis unit or your transplant coordinator that you are unwell and that you will be in an ER in the next couple of hours. And also take a moment to notify your work or school if that's relevant, because it may be 4:45 in the afternoon, and it's a lot easier to advise your work that you may miss the following day before 5 o'clock instead of worrying about it while you're in the emergency room. And it's one less burden to have on your chest while you should be focusing on your care in the ER. And what do I mean by having an emergency folder? Basically what I mean is having a concise compilation of information that'll help you and the ER staff implement and coordinate a plan of care that's personalized and effective for you. And like it shows in this slide, make sure that it's concise information, Don't bring a whole stack of papers that's going to be confusing and laborious for people to go through. Simple things to keep in that emergency folder includes your information, your next of kin's information, the names and contact numbers for family members. Also include the name and phone numbers of your PCP, your nephrologist, your dialysis unit, your pharmacist, also very important in case the ER doctor needs to call in medications to the pharmacist upon discharge. And also make sure that you have their after-hours numbers. A lot of practices will have an after-hours paging service, which allows you to get a hold of an after-hours provider should you need it. And that can also be very helpful for the ER staff to help in coordination of care. Also include a copy of your ID and your insurance information. And in addition, it should also include some medical information. And again, keep it concise. Politely ask your nephrologist or your PCP or both to provide you your last clinic note, which contains a short narrative about you. And this can be something like, Mr. Smith is an 82-year-old gentleman with high blood pressure, diabetes, cholesterol, blah, blah, blah. Basically something that helps the ER doctor get a quick glimpse of your medical history and know something about you that you may forget to divulge when you are seen, or that you may be unable to do so when you're very unwell. Also include your most recent lab work, including your most recent creatinine and kidney function if you're not on dialysis, because it gives the ER team a baseline of your kidney function. Also include, if relevant, your EKG strip, any CT or MRI results that may have interesting or unique information specific to you. For instance, if you know that you have an abnormal EKG, it's good to have documentation of that EKG, which outside ERs can refer to before declaring your EKG as representing a heart attack or some other problem when in actuality it's completely normal for you. Also pack any documentation of medical devices such as a stent, pacemaker, or implantable defibrillator. On this slide, I have an example of an implantable defibrillator patient identification card that includes medical issues to patients, which includes the name of the patient, the model number and serial number of the device, including the implantation date. Also carry with you proof of vaccinations and, of course, a current list of medications and allergies. And I cannot emphasize the importance of making sure your medication list is current, because an old and outdated medication list can potentially be dangerous if that's what the ER assumes that you're currently taking. And then there's the emergency kit or your emergency bag. This is a lot like planning for a trip with a few extra items that you may not think of. So having a change of clothes, personal items packed away for when you need it is always a smart idea. Throw in a charger in case you forget to take it when you leave the house for the ER. Also pack snacks and a water bottle, particularly if you're a diabetic and you're going to be waiting in the triage area for a long time and in case your sugar runs low. Also, very importantly, throw in some hand sanitizer, gloves, wipes, and plenty of face mask with you. As you're probably aware, emergency rooms and triage areas may not be the most hygienic and clean, despite the hospital's best efforts to keep them clean, and it's important to stay safe. So bring hand sanitizer and these other items with you. And if you happen to be a PD patient or a home hemo patient with a catheter and you have supplies for those catheters, please bring them with you. Of course, only a trained expert should manipulate your catheter when you're in the emergency room, but in case they don't have those supplies, it's always good to have your own to expedite your care. And finally, if you're a diabetic with an insulin pump, make sure you bring plenty of insulin cartridges with you and a glucometer as well. Then what should you expect when you reach the emergency room? Basically, upon arrival, you'll be screened through security. You'll then go to the registration desk to give your personal information and insurance information, and then you'll be seen by a triage nurse. The role of the triage nurse is to quickly assess what's going on and to gauge your level of acuity. They will ask you what your symptoms and concerns are, but it's also important that you tell them if you're a dialysis patient, if you've missed a session of dialysis, and it's also important to tell them if you're a transplant patient on immunosuppression or if you're on immunosuppression for another reason, because those factors can change your level of acuity, which they may not be aware of if you don't tell them. And do realize that you will be seen in the order of that acuity and not in the order of arrival. So someone with a gunshot wound who arrives after you will likely be seen before you. And if it's a long time before you get seen, it's not because your case is not important. It's simply because the ER staff want to give you their undivided attention, and it makes more sense for them to see the more pressing issues first so that they can see you in a timely manner and give you that undivided attention that you rightfully deserve. And then finally, triage staff are required to ask some standard questions when you come to the emergency room. Please take the time to answer those questions carefully and politely, even if they don't seem relevant to you. Those questions are to help the flow of the emergency room and to facilitate everyone's care, and it only slows down your care if you get upset with the people asking the questions because they don't have a choice and they simply have to ask. Then once you've cleared triage, you'll then be escorted into a bed or a cubicle where you'll meet the ER physicians and nurses. And there are some things to note when you're here. If you have a PD catheter or a fistula that should not be manipulated, advise ER staff clearly and politely that that should be so, and they'll gladly oblige. Many people who work in the emergency room, particularly junior staff, are not familiar with kidney patients, and it's important that you tell them certain things before a mistake happens. And also note that you may be seen by more than one provider, such as an intern, resident, fellow, or attending. You may even be seen by a medical student before you get seen by a licensed physician. But do bear in mind that all junior doctors and medical trainees are under the supervision of an attending, and the quality of your care is no different if you're seen by a resident versus an attending. Please take the time to answer all the questions and provide as much information as you can. Even if you have to repeat the history several times, it's important that the care team all know your history firsthand. And as frustrating as it is to repeat the history, it is in your best interest to tell everyone so they all have a grasp of what's going on in your care. Now, if after being assessed and treated by the medical team, the doctor expresses concerns about discharging you, please take the time to weigh the pros and cons of leaving if you don't think that it's necessary. Think about what might happen if you do elect to leave, despite their suggestions, and what might happen if your condition were to worsen, and the impact that it would have if you needed to come back to the emergency room. If after careful deliberation you do elect to leave, please work with the provider to come up with a safe backup plan in case things don't go the way that you expect, rather than simply signing out against medical advice and leaving. And before you do leave the emergency room, either on your own accord or after being formally discharged by the ER team, please remember to obtain a copy of your treatment summary and your patient instructions, because your nephrologist will want to see the treatment summary the following day, and it also helps facilitate continuity of care. Now, you should always expect to be treated with professionalism and courtesy, but also keep in mind that ERs, particularly in this day and age, may be short-staffed with busy personnel, and a seemingly rushed encounter likely reflects the work demands on the staff rather than a lack of interest in your care. Now, just to shift gears very briefly and to highlight some policy issues that this topic brings to light, I think it's quite apparent to all stakeholders that the ER is an overutilized setting for the initiation of dialysis and for avoidable kidney-related emergencies. And I think part of the delays in care is related to patient apprehension and reluctance. And that reluctance is a result of past and current states of kidney care themselves. And by that I mean patients are traumatized by words like dialysis or transplant based on horrific stories that they may have heard in the past. And it's time that we redefine the conversations around promoting kidney wellness and choices in schools, community groups, and health campaigns early in life, rather than waiting to have those reactionary conversations in the doctor's office when kidney disease is already too far advanced. When we know that 1 in 7 people are going to have chronic kidney disease, there really is an ethical obligation to treat these issues early rather than waiting for them to progress to the point that patients feel that they have no choice but to start dialysis or get a kidney transplant or have some other acute intervention done to them. So just to summarize, it's important to understand and manage your kidney condition and other medical conditions to optimize your health and to mitigate the need for ER visits. In the event of an emergency that you have to go to the emergency room, it's always important to have an ER action in place that's preemptively planned through your family and your healthcare providers. And also make an effort to get the most out of your ER visits through careful listening and communication with the team. And remember that the ER team is there to help you. So with that, I'll thank you for your very kind attention, and I'll be very happy to take questions offline from patients, families, or anyone from industry or experts that are involved in policy design and development. Thank you so much.
Thank you, Dr. Paul, for an excellent and important presentation. On behalf of the AAKP, I appreciate you sharing your time and expertise with us.